name is Beth Shelley. I'm a physical therapist, and I'm here today at Gilda's Club in Davenport with Jamie and Sheila, and we're going to talk about lymphedema. Lymphedema is a condition that involves swelling in the entire limb. It could be swelling in the entire arm, or it could be in the entire leg. There are different conditions. Let's talk at the beginning about what the lymphatic system does. We know a lot about many systems in medicine, but the lymphatics is something that we don't know very much about. Even the people who know everything there is to know don't know very much about the lymphatics. We're learning every day, but we know a few things. We know that there are lymph vessels. They're very, very thin, and they're all throughout your body, all through your arms, through your trunk and your face and your skull, all down into your legs. These lymph vessels are very thin, very fragile, and they travel back towards the trunk and interact at lymph nodes. Lymph nodes help to clean out the lymph. You have a few lymph nodes in the front of your elbow. You have a lot of lymph nodes in your armpit. You have many, many, many down into your trunk and your neck. And there's also a very big group in the groin on each side and then behind the knees. Lymph is a fluid that helps to bathe the cells. It brings nutrients to the cells, and then it brings the waste products back into the trunk so that your body can clear them out. It's really the housekeepers of our body, and we need them. We need to have a good working lymphatic system. It's part of our immune system. So we know that lymph moves down the arm and back up the arm all day long, bringing good nutrients down and taking the waste products back up. And when it works well, that's really good. But when it doesn't, usually the challenge is that it can't get back out. And that's where the swelling pools. There are many different reasons why lymphedema might occur. Sometimes it's related to a trauma to the lymph nodes, and this is often related to cancer treatment. The armpit is sometimes involved in breast cancer diagnosis or even diagnoses in the neck and the chest. And the groin is involved in cancers that would be in the pelvis, the uterus, the prostate, ovaries, those sorts of things. So when there is a removal of the lymph nodes or when there is radiation of the lymph nodes, both of those conditions can shrink wrap the lymphatic system so that it doesn't have a nice clear path going back up. We don't have a lot of statistics about why somebody does and doesn't get lymphedema. We know that about 20% of women who've had a mastectomy will get lymphedema. But that isn't something that would come necessarily immediately after the surgery. It could come 3 days later, it could come 3 months later, it could come 3 years later or 10 years later. We don't know all of those answers. But we know it is an occurrence that would be helpful to know about ahead of time. Lymphedema is a chronic condition. That means that once you have it, you have it. It can be managed, and it can go into remission, but it won't ever completely go away. It will be something that you have to pay attention to. So it would be good not to get it, right?
Right.
Yes. And these are some ideas not to get it. Now, I said that the lymphatic system is involved in your immune system. So when you have an infection, the body says, hey, lymphatics, come on down. And it calls down the lymph in order to help chew up and get rid of that infection, which is perfectly fine, except it's sometimes hard to get that fluid back up, and that is the challenge. So avoiding infection is important in avoiding lymphedema. Even taking one step back, if you avoid having an open area, you would avoid infection. Our skin is the largest organ in the body. Its job is to keep the outside out and keep the inside in. And it can't do that if there's any kind of a break in the skin. This is what we call casual injury, and it would be good to avoid. Casual injury could involve where the cuticles come together, that you get a little bit of a hangnail. It could be a blister on your foot, that would be casual injury. Or if you're walking around the yard without your shoes on, you might get a little nick or a scrape. A burn is casual injury, so the possibility of putting your hand into the oven and getting a little bit of a burn on your arm. Even a sunburn is not a good idea. Insect bites, animal bites, needle sticks when you have blood drawn, or if you are a diabetic and you prick your finger. All of those things are considered casual injury. And casual injury leaves you more possible to have infection. So if those things happen, it's very important to wash the area with antibacterial soap, put a first aid cream or Neosporin, something like that on it, cover it with a Band-Aid, and watch to see that it improves. If it looks at all angry, angry, where it gets red and hot and it hurts and maybe there's some pus, if any of that happens, then you should call the doctor as soon as you notice it so that they can get you something more powerful in order to eliminate that infection and minimize the chance that the swelling will flare up. There are a couple of other categories of things that would be good to avoid. The fluid, as I said, moves up and down the arm. It would be good not to alter that fluid movement. A blood pressure cuff, that alters the fluid movement because that would make it less. The other thing that can make it less is a compressive cloth, like a band on your clothing. A tight top of the socks can do it. Jewelry can compress. And those times that you have a decrease in flow, you will have the possibility of more swelling. In addition, there are things that make the swelling or the fluid flow more, like heat. So it would not be a good idea if you had some trauma on your right armpit to have a heating pad on your right elbow or your right hand, or to put your arm in a hot tub. Those things would be a bad idea. If it is your arm that's involved, you could get into the hot tub and put your arm out. That would be okay. But if it's your leg that's involved, then you can't go in the hot tub. So remember that these precautions are very specific to the limb that's involved, whatever one it is. The other thing we have question about is air travel. When you go up in a plane, the pressure changes. And the arm and the fluid in the arm or the leg is very related to pressure. And it has been surmised or theorized that when you go up into an airplane, because of the pressure change, you have more chance of lymphedema. And some people notice this. They notice the onset after a plane flight, or they notice that if they have lymphedema, that it gets worse after they've been on a plane. So wearing a compression garment, like the ones we're going to talk about in just a moment, wearing that is important during flight. Now, as I said, we don't know a whole lot about the lymphatic system, and there is research coming out all the time. We now have one research paper that might call this into question. In other words, a research that looked at the occurrence of swelling after an airplane trip, and they did not find that it made a difference if a person had on their sleeve or did not. But that's only one study, so we're waiting for more research, and that might change. And then the last piece of prevention is another item that has changed. When you exercise a lot, you do increase the fluid movement into the arm. And so it was theorized that if you did too much exercise, lifting lots of boxes or rowing a boat, if it was your arms, if you did a lot of that, then you would have more swelling, or you would have more chance that lymphedema occurs. Well, we now disagree with that. Under controlled circumstances, if you have a compression garment on and you are doing well thought out strengthening exercises, the chance of the flare-up of lymphedema is less. So here we have a situation where the recommendation has almost completely reversed. And who knows, that may happen tomorrow on one of these other items that we're discussing here. So it is very important to keep in touch with your physician and your therapist, if you have a lymphedema therapist, that would be up on the research and know what the recommendations are and the things that we know now. So these are things that would be important to follow all along, forever and ever, if you have had a trauma to the lymph nodes. Once you get into the habit of wearing an oven mitt instead of having a pot holder, and using your garden gloves when you go out in the garden, or if you're going to do some heavy cleaning, that you would have a plastic glove, a rubber glove on. Once you get used to all of these slight changes, it isn't really a big deal. They're just things that you need to remember. So what happens if you have a swelling? It is very important to address whatever the condition is as soon as you notice it. The small amount of swelling can result in negative outcomes. Sometimes people say, oh, it's just a little swollen, I really don't care, there's so many other things to worry about, I can't be bothered with this. But it's important. It is. There are situations where the swelling can build up so much that the arm, although it's not very big, gets real hard, like Jell-O that's been in the refrigerator too long. So when you get that really hard feel, that means you know there is no good nutrients getting to your cells and there is no waste products coming out. And that's a formula for infection. Cellulitis is a condition which is related to infection of the skin. And the infection of the skin, the cellulitis, can occur only because there's swelling in that area. So it is a big deal. It's something that you want to make sure that you address. If you address it earlier, we know that it can be managed quicker and with less of the production that might be involved. If you wait until it is very, very large, then you'll have to have much more therapy and more types of treatments.